Good morning, everyone, and welcome to our last webinar of 2021, Pregnancy, Parenting and Arthritis. My name is Heather Beaumont-Johnson, Director of Services and Operations at Arthritis Action. Today I'm joined by our medical advisor and consultant rheumatologist, Dr. Wendy Holden, and by Kirsty Dilley, a first-time mum who lives with arthritis, and will be answering your questions around the journey of pregnancy and parenting for people living with arthritis. Hi Wendy and Kirsty, how are you both today?
Morning, I'm very good. I'm Wendy Holden, I'm Medical Advisor to Arthritis Action and Consultant Rheumatologist, and I'm mainly going to talk about medical issues to do with pregnancy and parenting and childbirth, including issues around getting pregnant, the pregnancy itself, medicines and arthritis, and as well as medical issues to do with childbirth and breastfeeding, and then what happens after the baby is born. So in terms of the medical information to do with conceiving and childbirth, I'm going to be speaking about the British Society for Rheumatology guidelines. The latest ones are from 2016, although they're obviously a work in progress all the time.
Morning, I'm Kirsty, a first-time mum. I'm an English teacher, currently on maternity leave, loving being a mum and enjoying my time off work. I have had arthritis for 12 years and before trying for a baby, I had quite a lot to think about. So I will be talking about my experiences and answering any questions you've got later on. My pregnancy wasn't an easy one, but I would do it again, mainly due to now I know what to expect. So I'm hoping these questions, and we can answer questions that will help you have an understanding and know what to expect for getting pregnant and becoming a mum yourself. So I look forward to answering any questions you'll have.
Thanks, Wendy and Kirsty, that's great. And thanks to any attendees who have submitted their questions beforehand. We will do our best to respond to them today. If you have any further questions you'd like to ask during the webinar, please click on the Q&A button at the bottom of the screen and type in your question. Then, time permitting, we'll aim to answer it at the end of the webinar. If we don't have time to answer all of your questions, then we'll be sure to email you with an answer from Wendy or Kirsty after the webinar. We will also be sending you an email with further resources and information. Also, a reminder that your cameras are off for this webinar, so please feel free to stand up and stretch at any point, and you might see any of us doing that as well. So we will now jump right into the questions. So, Wendy, I have rheumatoid arthritis. Will I pass it on to my baby?
Yeah, that's a good question, and that's one that lots of parents, not just with rheumatoid arthritis, worry about, but people with other sorts of arthritis worry that they might pass it through to their baby. But the answer is probably not. Some types of arthritis do run in families, but just because you've got it doesn't mean that your baby will then go on to develop the arthritis, because lifestyle and environmental factors are equally important in this, if not more so. So as a parent, you've got enough to feel guilty about without worrying about whether or not you'll pass the arthritis on to your child. So try not to worry about this, because most women, or men in fact, with arthritis won't go on to have a baby who gets arthritis later on.
Oh, that's good to know. So the next question, Wendy again, will I have problems getting pregnant if I have arthritis?
It used to be thought that women with rheumatoid arthritis or other types of inflammatory arthritis might have difficulty conceiving, but we now know that provided the arthritis is under good control, in other words, the inflammation levels are low, there shouldn't be any issues with becoming pregnant or indeed having a healthy and normal pregnancy and birth. However, if your arthritis is very active, it might be that it's more difficult to become pregnant in the first place. You might not feel like getting pregnant in the first place. So try and plan ahead with this and discuss things with your team.
Thanks, Wendy. Kirsty, was this a worry for you, and did you have to think ahead?
It was a worry, and I did have to plan quite far in advance. I mean, I spoke to my doctors quite early on, because I had the worry of getting pregnant, and I didn't really know what to expect. So I had the questions quite early on, even before I decided that I was going to have a baby, just so I knew what was coming and what to expect. Um, I mean, I think the doctors were amazing, and they really like just gave the advice of what you needed to do about becoming pregnant. Myself, I found that being healthy and keeping active and making sure my arthritis was under control before I tried to conceive was probably the best thing that I did, because then well, it helps everything run a bit more smoothly if you haven't got a flare up at the time of trying to conceive as well. So I think just talking to the doctors and making sure you've got a bit of a plan before thinking about having a baby is probably a good idea.
That's good advice, Kirsty. Thank you. Wendy, there's a question here, which is, what about lupus and pregnancy? So are there any concerns around people who are living with lupus as well as arthritis?
Yeah, that's a good question. So lupus is a different type of condition, really. It's an autoimmune condition, and some people who have lupus have an associated condition that goes with lupus, which is called antiphospholipid antibody syndrome, and that condition can be connected with recurrent miscarriage. So miscarriage, unfortunately, is very common anyway, but people with antiphospholipid antibody syndrome can have many, many miscarriages. So if you're in the situation where you've had more than 3 miscarriages, that's what we call recurrent miscarriage, or if you've sadly had a neonatal death, then it's quite important that you get yourself tested for one of these conditions or other conditions that can cause recurrent miscarriage, because about 1 in 5 women with recurrent miscarriage will have an underlying cause, and one of them might be an immune condition that can be treated. And so obviously you'll need some supportive treatment during pregnancy, and that can help you have a successful outcome.
Well, that's good to know, because relatives of mine have had miscarriages, but I wasn't aware of that, and I don't think they were told that either. Mm-hmm. So that's good information to know. Wendy, another question is, will my arthritis medicines affect my ability to get pregnant?
Yeah, that's a good question. So most medicines prescribed for arthritis won't affect fertility in itself, but some can harm the developing baby. So if you've got arthritis, like Kirsty was saying earlier on, it's really important to think ahead and discuss your medicines with your rheumatology team. Now, there's an exception to that, in that anti-inflammatories or NSAIDs such as naproxen or ibuprofen or other anti-inflammatories can sometimes be connected with problems to do with implantation. In other words, the fertilized egg might not implant properly. So it's a good idea to stop those before you try to become pregnant. Often implantation failure can happen even before you know that you're pregnant. So stop those if you're thinking about pregnancy.
Okay, thank you. Kirsty, what was your experience with medication?
Yeah, so like Wendy said, I actually made a plan with my doctor, and I came off the medication I was on and went on to a different medication that was safe to become pregnant on. And actually, when I was pregnant, I came off my medication altogether because I felt really good, and the doctors were happy that I didn't actually need it if I didn't want to. So I made the decision with them to come off of my medication. But yeah, I mean, if you're feeling like anxious about the medication, just talk to your rheumatologist or your doctors and just have that plan in place so you definitely know what the time frame is as well, because some medicines you have to come off for a certain period of time, which is what I have to do. So just make sure you understand everything, and then make a plan, and then it's really good. Once you have that plan in place, you feel at ease with what's going to happen.
Thanks, Kirsty. So it's important to ask questions of your medical team and to make a plan before you think about getting pregnant. Okay, Wendy, there's another question here. Will my medicines affect my unborn child?
Yes, definitely, well, not definitely, but possibly. So certain disease-modifying drugs must not be used through pregnancy because they can cause birth defects and miscarriage. In particular, methotrexate, mycophenolate, and cyclophosphamide are definite no-nos for becoming pregnant and need to be stopped. Now, leflunomide, previously it was recommended that was stopped before pregnancy, but the jury's out about whether or not it causes birth defects or not. But even so, most women will stop that drug before becoming pregnant. Other drugs, so for example steroids, for example prednisolone, hydroxychloroquine, cyclosalazine, and others are considered relatively safe, however, through pregnancy and breastfeeding.
Okay, thanks. And then there's also the biologics. And when, if you're on biologics, when should you stop taking your medicines, or should you stop taking them?
Yeah, that's right. So some biologics, the ones called anti-TNF inhibitors, for example, infliximab, which was the first biologic, or adalimumab, a more recent one, they've been used now for around about 20 years. So although there's limited evidence of their use in pregnancy, it's increasing all the time, and they're generally considered safe at least through some parts of pregnancy, whereas other newer biologics, for example tofacitinib, tocilizumab and rituximab, I'm glad I said that, sorry about those, yeah, exactly, are not really considered safe at all in pregnancy. So if you're taking any of the more modern biologic drugs, it would usually be suggested that you stop those in advance. So in terms of when to stop them or switch them, it obviously all depends on which ones you're taking, because they're all different. It depends on your feelings about medicines and pregnancy, and also, of course, how active your arthritis is. So many pregnant women find it's all quite confusing. I'm not surprised. So that's, as Kirsty said, it's really important to plan ahead. So you make a plan about what you'd like to do. And the timing of stopping each medicine varies between each medicine. So anti-inflammatories should be stopped either before pregnancy or as soon as you know that you're pregnant. They're generally considered safe in the middle part of pregnancy, but then they need to be stopped again around 32 weeks, as they can affect the circulation in the unborn child if they're given too close to childbirth. So that makes the end phase of pregnancy for many people quite a difficult one, because you're left slightly in the lurch towards the end. So generally for disease-modifying drugs, about 3 months is the time that is usually recommended. For leflunomide, it's much longer. It's going to be 2 years, or have a washout, what's called a washout procedure, which involves taking a medicine that will suck it out of your body. In terms of the anti-TNF drugs and biologics, some of them are big molecules, so they can't physically get into the baby or into the breast milk, so they're safe through pregnancy and breastfeeding, in particular one called certolizumab, or its trade name is Cimzia. Other ones may well get through the placenta, so they're usually stopped at a different time of pregnancy. So ask your rheumatology team for advice depending on which drug you're taking. The other thing to say is that men taking sulfasalazine might have a reduced sperm count, so this is not to be relied on as a method of contraception, but fertility can be impaired somewhat in men taking this drug. So again, discuss if you've got concerns.
Okay, thank you. Gosh, that was a...
Sorry about that.
No. It's good for people to know, but I understand why Kirsty's saying ask questions.
Yeah.
And make a plan. So Kirsty, I've got a question for you now. First of all, what will happen to my arthritis when I am pregnant?
Yeah, one that I was a bit worried about myself. I was actually really lucky with my pregnancy in terms of my arthritis. It completely calmed down to the point where I actually forgot that I had arthritis. Probably at the beginning I was quite sick at the beginning, so the sickness obviously had that to think about. But during the middle of my pregnancy, I felt amazing, I have to say, probably the best I've felt in a long time. But I was reminded quite a lot about my arthritis because I had extra appointments and extra assessments that I had to have, routine checks, which, yeah, so I didn't forget about my arthritis completely, but I did feel really good. I mean, I had to have extra scans, extra growth scans, extra other scans that I had to have for routine checks, which actually was a bit scary at the time because I didn't really know that this was going to happen. It wasn't until I had an appointment letter or was told at my midwife appointment that these were going to happen, that I actually knew about them. So I think for anyone that's trying to get pregnant or is pregnant, it's quite nice to know what to expect, because it was actually really scary for me, these appointments. But now I know about them, and if I was to get pregnant again, I'd be a lot calmer, and at least I'd know what to expect. But in terms of my arthritis, I think just trying to eat well as well, like for everyone, eat well and just keeping active. My arthritis was pretty good throughout the whole of my pregnancy.
Okay, thank you, Kirsty. Wendy, would you like to say anything to that question? So
I would.
Pregnant?
Yeah, so it used to be said that all arthritis went away during pregnancy when the estrogen or the hormone levels were high, but we now know that that's not always true, and lots of women feel guilty about this. So about 60% of women will feel better when they're pregnant, but 4 out of 10, the arthritis will stay the same or get worse. So stay in touch with your team so that they can respond to your needs.
Okay, lovely, thank you. And Wendy, another question. What should I do if I stop my medicines and my arthritis flares up when I am pregnant?
Yeah, that's a good question too. So usually it depends how bad the flare is. A minor flare can sometimes be managed with anti-inflammatories or mild painkillers if needed, but sometimes a tiny dose of prednisolone or corticosteroid might be needed, often by an injection into a muscle to settle things down, or sometimes people might need a particular joint injected during pregnancy, and that's considered safe usually.
Okay, that's great, thank you. The next question is, what if I have stopped all my medicines and I don't get pregnant straight away?
Yeah, that's and obviously that's an issue because some people are lucky enough to fall pregnant straight away, and for some people it might take months or even longer. So if your arthritis stays under good control and you come off your medicines, then there's no need to worry. But the challenge comes if you've been trying for a while and you don't get pregnant, and then your arthritis starts to kick off again. So obviously what you need to do depends on how bad it is and how long and how much you're prepared to put up with. So as I said just now, sometimes a steroid injection can help, or if things are really going not very well, then you might need to just pause with the thought about pregnancy, get your arthritis back under control, and then start again. So stay in touch with your team for advice on that, but just definitely don't stay off all your medicines and just struggle in silence. Please call your team for some help.
Okay, thank you. We're going to have some questions now on breastfeeding, and we have had a question in from a participant this morning who says, can I continue to take etanercept, I think that's how you say it, now even when breastfeeding? I am not certain about that answer, so you will need to please check current guidelines because they keep changing all the time. I think I'm not going to give an answer to that one. I'll need to check on that one. Okay, that's great. Thank you. So we'll get back to you with the answer to that, hopefully. So will I be able to breastfeed my baby? Is the question, I guess. Well, if you want, absolutely. If you want to, there's no reason that you shouldn't do if you want to. But obviously, it's a matter of complete choice. And sometimes
having a baby and having arthritis and everything all going not wrong, but being challenging all at the same time is difficult. So don't feel guilty if it just doesn't work out for you, because you just have to do what's right for you. So ask. Some medicines should be avoided during breastfeeding as well, as that question alluded to. Obviously methotrexate and disease modifying drugs would generally be avoided during breastfeeding, so ask your team for advice on that one. And the advice changes quite quickly, so what's true today might not necessarily be true tomorrow as more evidence comes in. So Kirsty, what was your experience of that?
Well, I didn't breastfeed in the end. I did want to, and I did try, but for me it just didn't happen. I'm not really sure why. Some people it just doesn't happen for. And like you said, Wendy, it's not to feel guilty about, because actually bottle feeding to myself really helped, because my partner could do a lot of the feeding as well. So when you're really tired at the beginning and you're up all night, it's quite nice for them to do some of the feeding. But yeah, so my experience with feeding was absolutely fine. The nurses and the midwives were really good because you do get a specialist come round as well to talk about breastfeeding, which was really helpful as well. So I did feel guilty at first, but once they spoke to me, I felt fine, and like, my baby was being fed, which is the main thing. So yeah,
Okay.
it's all good.
Thanks, Kirsty. So you know, I'm Wendy and Kirsty. This is just a question I'm thinking now. You know, if you had arthritis in your hands, or your arms or your shoulders, and so the weight of the baby might be difficult for you to breastfeed or to bottle feed. How would you suggest overcoming that?
What do you think, Kirsty?
Well, I actually use the arm of the chair, like you can rest. Also, I have a reclining chair in my living room, so I still use it now. I recline my chair and it's just more comfortable. So I'd just say, as long as you're comfortable, or just make sure you've got pillows to support, and just use as much support as possible. That's what I do. Just the pillows help really take off the weight. But yeah, just whatever's easy for you. Just try different positions, and just there is actually for breastfeeding a really good position that I learned in a antenatal course, which is like a rugby hold. So it's like I think that might be quite comfortable. It looks quite comfortable, or you could just lay down. But yeah, so just make sure you're comfortable, I would say, and just try anything that you can.
Yeah, definitely. It's quite a good workout, isn't it, having a baby, because of the upper arm constant lifting, and that baby's going to be attached to you for quite a few hours every day. So it's really important that you get yourself comfortable, isn't it?
Yeah, I have to say my arms, I have my strength in my body is so much better. And I think that's probably why my arthritis is a bit more under control, because I have more strength. But you just get used to it, to be honest, and you don't really think about it. You just do it, like you have to, so you just get on with it. So
there's a lady called Vicky said she uses support pillows to help. And going back to the previous question, we have a nurse online today, and she's saying, you know, always check the BSR guidelines, and she's given a useful link there as well. So thank you for that. Next question. Will my arthritis cause problems with childbirth?
Yeah, I mean, no. Having arthritis doesn't necessarily mean that you're going to have issues with childbirth above and beyond someone who doesn't have arthritis. But obviously, if you've got particular problems with your hip joints or your back or your sacroiliac joints, you might feel a little bit anxious about this and what might happen. So you definitely should discuss your birth plans with your obstetrician in advance. So the other thing to think about is if your arthritis has been very active when you've been pregnant and you've come off all your medicines, this can increase the risk of your baby being born early or having slightly lower birth weight. So it's really important to stay in touch with your rheumatology team so that you staying well, the essence is if you stay well, then your baby will stay well, and then you're much more likely to have a happy and successful birth. What's happened to you, Kirsty, during your delivery?
So exactly that. I did have a problem with my hip in the end, and I had a planned C-section booked in. But like Wendy says, the baby may come early, and in my case, he was a month early. So I was, my waters broke, and I was taken to hospital. They tried to keep me in, they tried to get the baby in for as long as possible, but in the end it was a C-section after 5 days of being in hospital. So yeah, I mean, the doctors are amazing, like, they will give you advice that you need, but in yourself, if you do what you need to do, you know your body best. So if you feel like your hips are really bad and you're worried about it, it can be something that plays on your mind throughout your whole pregnancy. And I think just having that planned C-section for me was a lot less to worry about. Even though that wasn't the case and he did come early, but it was still, at least I knew what was going to happen and I didn't have to worry as much. And yeah, my birth was really good after. Yeah, he was healthy weight. I didn't have any extra care for him, so yeah, it went really well in the end.
Oh, that's really good. Although when we were talking earlier, you said just to let people know they should wash their hair before going into hospital.
Just in case you have to go in early and you have to wash your hair that morning. Yeah.
Okay, the next question, Wendy, for you, I think. I have heard that some people with arthritis have a flare after the baby is born. Is that right?
Yeah, that's often correct. So especially if your arthritis has been good through pregnancy, after childbirth, especially if you're not breastfeeding, the pregnancy hormones drop quite quickly. So around about 4 or 5 out of 10, so about half the women will have a flare around about 6 weeks once the hormones drop. So a useful thing to do can be to book yourself in for a planned appointment around about 6 to 8 weeks after the baby's been born. So you're there, you've got it planned just in case something goes a bit wrong. Of course, it may not go wrong, but then that will be around about the time that it might go wrong if things are going to go wrong.
Okay. So, Kirsty, can you relate to this?
Well, I've been quite lucky. My arthritis hasn't been that bad since I've had my little boy. It has started to flare up a little bit now, but only like a tiny bit, like not too bad. Just my hands are a bit swollen. But I find that the main thing, I think, is just to get out for a walk as much as you like. Every day I've been going for walks, just to keep moving. And I've also tried to eat really healthily since having him as well. Like, I think you forget to look after yourself when you've got a baby. So I think one of the important things is to just look after yourself as well, and don't forget to get out and have a little bit of a walk. It just makes you feel a bit better. And then, like Wendy says, if you do have a flare, book an appointment. I had a telephone appointment, and they just did a little check on me just to see how I was doing. I mean, I am going to go back on my medication, but just not at the moment. I've just got to have a blood test and then go back on it. But yeah, I've been quite lucky, I think. I've kept myself quite active, and I have been quite lucky that I haven't had a major flare up. So which is good. And fingers crossed, it stays that way.
Fingers crossed, definitely. So when should I restart my medications is another question.
There's, like Kirsty said, there's no sort of hard and fast rule on this. If your arthritis is under good control like hers is, then you may well just want to pause and wait and see what happens. On the other hand, if your arthritis is starting to burn and get more active again, then you will probably want to get straight back on your medicines as soon as you can, because you'll have enough to think about looking after the baby without fretting about your arthritis. So stay in touch with your team, especially if you're on a biologic, because they will need to do some paperwork to get you back on your biologic so that they can be responsive for you and help you as soon as possible.
Okay. There's a question here from Colin. Can steroid injections or tablets affect the baby if breastfeeding?
Thanks for that one, Colin. Steroids will go into the breast milk, yes, and they will go into the baby, but it obviously depends on how big a dose that is. I think with a joint injection, obviously that's a very small amount of steroids, so that's very, very unlikely to have an effect on the baby. But if you're needing large amounts of steroid tablets to control your arthritis, then that potentially could go into the baby and cause some difficulties with the baby's immune system, which you obviously don't want. So I think the ideal in that situation would be to get yourself started on some definitive medicine, or even think about not breastfeeding potentially, obviously depending on how much steroids you need. So that's a good question.
And then another question that's just come in is, will I suffer with more fatigue in pregnancy?
I think almost certainly would be the answer to that, because, well, I don't know about you, Kirsty, but obviously in the early stages of pregnancy, fatigue is sometimes a really big thing. Women say they're exhausted and they go to bed at 8 o'clock and things like that. But often in the middle phase, it's a pretty perky phase.
Yeah,
so having up, yeah. Is that what happened to you?
Yeah, definitely for me, the beginning, well, I had sickness for the first 3 months, and I was really tired. And then in the middle, it was amazing. And then towards the end, you get tired again and you find and I think, well, you've got all the extra weight as well. So you need to kind of just try and rest as much as you can. But yeah, you do get tired. I just listen to your body. If it's saying you need to rest or have a day, or if off work or something, then I'd just have that day to rest, because at the end of the day you're growing a baby. It's not an easy thing to do. So definitely tiredness is definitely a thing during pregnancy for everyone, whether you have arthritis or not. I would imagine. Well, all my friends tell me anyway that.
Yeah, definitely, and you don't have to be like Paula Radcliffe running marathons right up to the very end. So don't let those super women of sorts make you feel guilty about anything. You know, you are what you are.
I like that, Wendy. You are what you are. Absolutely, that's great. We've spoken a lot about the experience of women, but what if a partner has arthritis? Should he stop his medicines before trying for a baby?
Yeah, so most men will want to do this, and it used to be said that men should do exactly the same thing as women. In other words, stop the methotrexate or whatever they're taking 3 months before trying to conceive, because it takes about 3 months for a new sperm cell, or 2 to 3 months for a new sperm to develop. But there isn't actually that much evidence that disease-modifying drugs in men cause any birth defects. However, most men will still want to come off their drugs, and of course, once they've done their necessary, then they can resume their medication as soon as possible.
Okay, great. That's really good. So we've sort of looked at pregnancy, and we've had some suggestions in the chat box if you want to have a look there. We've answered some of the questions that came in beforehand. We've answered some questions which we had online this morning. So if you have any more questions, please pop them in the chat box. But in the meantime, we're going to move on to looking a little bit about parenting and arthritis instead of getting pregnant and the immediate aftercare of babies. So some practical steps that maybe people conclude, or maybe people out there have got tips and hints that they could share as well this morning. So I know some people don't like to say to their children when they are older, some people don't like to say to their children when the children are a little bit older that, you know, it's not a good day today, my arthritis is playing up. But one of the things that some people do is they have a traffic light system. So they will put on their fridge, for example, if it's a good day, they'll put a green sticker up there. If it's not such a good day, they'll put an amber sticker up there. But if it's a really bad day, they'll put a red sticker up there. And so this just lets the family know how you're feeling without you actually having to tell the family. So, you know, some people find that helpful. Or, you know, if you're in a bad day, then some people will just do board games instead of running around outside with their children. Or for younger children, it might be helpful to find some aids that you can help to carry your child in. You know, that again is something which might be helpful. Excuse me. So, you know, you can ask your friends and family and members if they're able to support as well. Can they help taking your child to a club, or for example, or, you know, pacing yourself? It's really important to pace what you're doing. You know, some days when we feel great, we think, great, it's a good day, I'll go out there and I'll do everything I can. But then you suffer the following day. So it's about learning to pace. And it's the same with children. Learn to pace yourself. And have your support there with your family and your friends. And I know a grandparent who they can't use they couldn't bend down to pick things up if a child dropped something. So they would actually tell their child that, you know, their grandchild that they couldn't do this. And so the grandchild would go around and pick everything up. So, you know, that's a great way to teach children to put things away at the end of a playtime. So Kirsty or Wendy, I don't know if you've got any tips that you feel you'd like to share for people with children who are a little bit older.
Kirsty, can you? What about gadgets or things that helped you when you were had a very little one?
Yeah, so my little boy is only 7 months, so I don't have any advice for when he's older yet, but I do like the sound of the traffic light system. That sounds quite nice. But I would say gadgets for me would be a light pushchair. So you can get some really light pushchairs. Now, I've actually found since meeting up with my mum's friend that my pushchair is quite heavy, and I actually thought that it was quite light. So there are lighter pushchairs, and I'm actually thinking about changing my pushchair now. What's less, like, extremely light. So yeah, I would say a light pushchair, like shop around and just try a few out. Also, one thing I did buy recently was quite a thick play mat to go on my living room floor. So when I'm bending, like when I'm kneeling on the floor, because my knees do hurt when I kneel on the floor, it just gives you that extra support. Because I used to just throw cushions on the floor and kneel on those, but now I've got this really comfy play mat. It's quite nice just to sit on there. Other gadgets, like a sling. If you don't have back problems, I don't really suffer with my back. So a sling is quite good, one of the wraparound ones. It's quite handy just for that extra support. But yeah, just those are the things I've come across so far. But I'd love to know if anyone else has got any gadgets they can recommend. To let us know, that would be good.
Yeah, that 360-degree car seat is a great idea, isn't it? Because that is such a faff, isn't it? Getting a wriggly thing into a car seat, yeah.
Yeah, the 360 car seat is good for when they're older. Yeah, that's a good one.
I've just had a dad give me the same information. He says get a baby car seat that can twist to prevent you having to bend and twist to get your baby toddler into the car. And you know, if you can afford it, a car that's higher, off the ground might be easier as well. So there's some tips there. And Colin's saying, dads, if they have arthritis and they can't play football or rough and tumble games, that they look at water-based exercises as a great way of spending time with the children. That's a good one, Colin. And I met a dad who was quite emotional because his arthritis was stopping him playing with his children. And he got really upset because he couldn't play football and the rough and tumble games. But yeah, getting in the water, that's a great one. And the kids would love it too, wouldn't they? They would love that. Any advice anybody's got on how to manage pain when you're getting bigger and less mobile and get the lowest dose of pain relief?
That kind of goes with the question about fatigue and lack of energy and pain first thing in the morning as well, question, doesn't it? So when you're pregnant, obviously, is different from when you're not pregnant in terms of what you can take for pain relief, and obviously depends on where the pain is. So if the pain's in your lower limbs because you're very heavy, then the sensible thing to do is try and get the weight off your legs if you can, and put your feet up whenever you can. I mean, if it's more around your pelvis and your sacroiliac joints, you may need to check in with a physiotherapist, because obviously as your ligaments get looser closer to the time of delivery, then that area can get really achy and heavy, and there's sometimes physio can be really helpful during that time, or support belts and so forth. Then I suppose as a last resort, you're going to need to do what you need to do, and if you absolutely need some pain relief, then I think you probably should take it and try not to fret too much, because it's better for you to feel slightly better than to let all those stress chemicals get into the baby. So an occasional painkiller is not going to do your baby any harm. Now the fatigue, what do you think, Kirsty, about the fatigue, and how do you deal with that pain and fatigue first thing in the morning, or fatigue especially? Yeah,
it's quite a difficult one. I think some days, like you say, Heather, some days you're good and raring to go, and other days you do feel. But I think you just, like I've said before, just listen to your body, and if you need a rest, then just rest. But again, thinking about swimming is really good when you're pregnant. So that's another thing. Even when you're not pregnant, swimming for me is the best form of exercise with arthritis, and water aerobics, if you like. I actually missed out on the pregnancy water aerobics because of COVID, and I was really gutted, because I was really looking forward to that, not just for exercise, but for meeting new mums as well. So I think for me, my pregnancy was a bit different because I had to wear shield, and I wasn't allowed to do any of those activities. So walking was the only thing I could do. So, and that's what I continue to do, because I find that that's the best thing for me. I think it's like just finding what works for you, and also just talking to your support network, your friends, your family. Just going off of topic a little bit, my mum friends that I've made online on an antenatal course is probably the best thing that's happened to me. I've actually, so for 7 months we've been hanging out, and they've got to a point where I spoke about my arthritis, and they help me out quite a bit. So if we're in like a class, like a sensory class, they will help me pick up Lucas while I get up off the floor, and they'll get me a chair if they can see that I need a chair. So I think it's just about talking to people as well. I mean, I've done this not said anything at the beginning when I had arthritis, but I think speaking out actually helps and makes you feel better as well. So I know I've gone off topic there, but I just feel like that's important, like to talk to people. and don't be worried about what people think, because at the end of the day, you just want the best for yourself, and people will always help you as well.
Yeah, no, that's great. Thanks, Kirsty. Good advice there. We have another question here. My arthritis gives me bad circulation. Will this get worse in pregnancy? And are there any sitting exercises to prevent this?
I think in general circulation would improve during pregnancy, because you know how pregnant women always want to have the windows wide open because they feel generally hot. So if you've got a problem with that, lack of circulation, then chances are the high estrogen will improve that. Generally, pregnant women are on the hot side, so I don't think that should be an issue necessarily.
Okay, well, that's good. And how do you deal with obstetricians who don't have much knowledge on rheumatology issues and therefore don't really offer up much support? Where do you go for advice?
Yeah, I mean, I think the thing is, the job of an obstetrician really is to deliver a healthy baby, isn't it? And to have a healthy mum at the end of it. So everything else is a slight luxury, I would guess, as far as they're concerned. So it's not surprising they don't necessarily know about people with arthritis, although of course they see all sorts, because they're doing this every day. So they see people with all sorts of medical issues. So they may not, however, and the other confusing thing is, of course, there are lots of different types of arthritis, so they would not necessarily be experts on your particular kind of arthritis. So I think the thing to do is to make sure that you speak to them and tell them exactly what problems you have. And Bonnie said something earlier on about and if you want an epidural, make sure that you're upfront about that, and make sure that facility is in place for you, because these days with the NHS, you've got to be prepared in advance and let them know what you want, so that you have the best possible experience. Like, it just suddenly occurred to me that for a lot of mums who've had babies through COVID, they may not have been able to visit the delivery room. So in the olden days, you used to go and have a little tour of the hospital, and then you could have a look at the facilities and the birthing pool and the equipment and stuff, and that would put your mind at rest. Whereas these days, it might not be quite so easy to do that. But there is loads of equipment available in the room. So there's wedges and cushions and birthing stools sometimes, and pools that are available to you. So, I mean, even if you can't go and visit, you will be able to discuss all that with your midwife in advance, and to see what is there for you, just to reassure yourself that you'll be able to get into the position which is good for you. So I think it's all about communication, really, isn't it? And you know your arthritis, you know the problems you have, so you have to take charge of that, really.
Yeah, no, that's a good message there. Take control. Ask the questions, make your decision, and then talk with the obstetrician about what's best for you to do. That's good advice there. And other question was about birthing pools. Is there any reason why somebody with arthritis shouldn't have a birthing pool?
No, I don't think so. I may well need to get out at some point, but I mean, in the middle of labour, it's difficult for anybody to get out of a birthing pool, so there will be people there to help you. So I think that should not be a problem at all.
Okay, great. And Kirsty, we're coming close to the end of the webinar now, but Kirsty, would you do anything differently in the future?
Probably not. I might get myself a little bit more active before getting pregnant again. I did try my hardest to get healthy, but maybe a little bit more active. And hopefully next time I'll be able to go to the swimming pool and the other classes. I would have liked to have tried a few more pregnancy related activities, just to get out and about and just keep myself moving. I think, knowing what I know now, I think next time will be a lot less stressful. So I do think, my advice for anyone who hasn't had a baby would be just to find out as much as possible, because otherwise, like me, you might get a few surprises along the way. So I don't think I asked enough questions at the beginning. I didn't really know what to expect. I asked a lot of questions along the way, But yeah, but I don't. Yeah, apart from that, I don't think I can think of anything else that I would do differently.
Okay, brilliant. Thank you. Wendy, Kirsty, thank you so much for all the information you've given us today, and thank you for everybody who's partaken in the chat room and asked all the questions. It's been lovely to hear from you. So that basically concludes our webinar on pregnancy, parenting and arthritis. If you'd like more information on the subject or anything else relating to arthritis, please visit our website www.arthritisaction.org.uk. We have a number of useful resources that will help you self-manage your condition, including detailed information on exercise, dietary information, wellbeing resources and tips on staying connected. A video of this webinar will be made available shortly on our YouTube channel. And we will send you an email with a link to the recording as soon as it's available. All that's left for me to say is once again, thank you to Dr. Wendy Holden and to Kirsty Dilley for answering our questions. And thank you to everyone for joining us. We hope you all stay safe and healthy, and we look forward to hearing from you soon. Thanks, everyone.
Thank you.